Drug addiction, also known as substance use disorder, is a chronic disease characterized by the compulsive use of drugs despite harmful consequences. It affects the brain and behavior, leading to an inability to control the use of legal or illegal drugs or medications. Causes of drug addiction. 1. Genetic factors. Genetic predisposition can increase the likelihood of developing an addiction. Family history of addiction can be a significant risk factor. 2. Environmental factors. Exposure to drug use in the family or social circle. Stressful life events, trauma, and peer pressure. Lack of social support and economic hardship. 3. Psychological factors. Mental health disorders such as depression, anxiety, and PTSD. Low self-esteem and a tendency to engage in risk-taking behaviors. 4. Biological factors. Changes in brain structure and function due to repeated drug use. Neurotransmitter imbalances that lead to cravings and compulsive behavior. Symptoms of drug addiction. 1. Behavioral symptoms. Compulsive drug seeking and use. Neglecting responsibilities at work, school, or home. Engaging in risky behaviors, such as driving under the influence. 2. Physical symptoms. Tolerance, needing more of the drug to achieve the same effect. Withdrawal symptoms when not using the drug. Changes in appetite, sleep patterns, and physical appearance. 3. Psychological symptoms. Intense cravings for the drug. Feelings of euphoria followed by emotional lows. Anxiety, paranoia, and hallucinations, depending on the substance. Commonly abused substances. 1. Alcohol. Most commonly abused substance. Can lead to liver disease, cardiovascular problems, and neurological damage. 2. Opioids. Includes prescription painkillers, e.g., oxycodone, morphine, and illegal drugs, e.g., heroin. High risk of overdose and respiratory failure. 3. Stimulants. Includes cocaine, methamphetamine, and prescription medications, e.g., Adderall, Ritalin. Can cause heart problems, psychosis, and severe mood swings. 4. Depressants. Includes benzodiazepines, e.g., Xanax, Valium, and barbiturates. Can lead to respiratory depression, especially when mixed with alcohol. 5. Cannabis. Includes marijuana and synthetic cannabinoids. Can impair memory, coordination, and cognitive function. 6. Hallucinogens. Includes LSD, psilocybin, magic mushrooms, and MDMA, ecstasy. Can cause hallucinations, altered perceptions, and emotional disturbances. Treatment of drug addiction. 1. Detoxification. The process of allowing the body to remove the drugs in a controlled environment. Often involves managing withdrawal symptoms with medical supervision. 2. Behavioral therapies. Cognitive behavioral therapy, CBT, helps individuals recognize and change negative thought patterns and behaviors. Contingency management uses positive reinforcement to encourage abstinence. Motivational interviewing enhances an individual's motivation to change. 3. Medications. Methadone, buprenorphine, and naltrexone for opioid addiction. Disulfiram, naltrexone, and acamprosate for alcohol addiction. Antidepressants and anti-anxiety medications to manage county-occurring mental health disorders. 4. Support groups. 12-step programs such as Alcoholics Anonymous, A, and Narcotics Anonymous, NA. Peer support and group therapy. 5. Inpatient and outpatient programs. Inpatient, intensive, residential treatment programs for severe addiction. Outpatient allows individuals to receive treatment while living at home and maintaining daily responsibilities. 6. Long-term follow-up and relapse prevention. Ongoing therapy and support to maintain sobriety. Development of coping strategies to handle triggers and stress. Prevention of drug addiction. 1. Education and awareness. Providing information on the risks of drug use and addiction. Promoting healthy lifestyles and coping strategies. 2. Early intervention. Identifying and addressing substance use issues early. Providing support and resources to at-risk individuals. 3. Strengthening support systems. Encouraging strong family, social, and community networks. enhancing access to mental health services and addiction treatment. Drug addiction is a complex and multifaceted issue, but with the right combination of treatment, support, and prevention strategies, recovery is possible.